rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Today I saw a patient who had recently undergone surgery for a gastrointestinal stromal tumor. He asked, "Doctor, what is the risk that this tumor will come back?" Rather than relying on tumor size alone, let's take a closer look. Our patient is a 60-year-old man who underwent complete surgical resection of a primary gastrointestinal stromal tumor. The tumor originated in the stomach. The greatest tumor dimension measured 6 centimeters. The mitotic count was 3 per calibrated 5 square millimeters. Let's assess this case using the AFIP/Miettinen GIST Risk Table in the OncoToolkit. The AFIP/Miettinen GIST Risk Table is a pathology-based risk stratification system developed to estimate the historical frequency of progressive disease after complete resection of a primary GIST. The model considers the primary tumor site, tumor size, and mitotic count. Let's enter our patient's information. First, select the primary tumor site. This patient's tumor originated in the stomach, so we'll select stomach. Next, enter the greatest tumor dimension. The pathology report shows a maximum tumor size of 6 centimeters, so we'll enter 6 centimeters. Now enter the mitotic count. The pathology report shows 3 mitosis per calibrated 5 square millimeters. We'll enter 3. Now click Calculate Score. Here are the results. The calculated historical progressive disease frequency is 3.6%. This corresponds to a low historical progressive disease frequency. This estimate is based on the selected pre-imatinib source cohort. It represents historical cohort data rather than an individualized prediction, cancer staging system, or treatment recommendation. To see how the result was calculated, expand how this result was calculated. The calculator combines the primary tumor site, tumor size, and mitotic count using the original 2006 AFIP/Miettinen Risk Table. For this patient, these findings correspond to a historical progressive disease frequency of 3.6%. You can click Copy Result to copy the assessment. To save it, enter the patient's name and click Save. Previously saved assessments can be viewed from the Saved Results panel on the right-hand side. If you'd like to learn more, scroll down to the reference data below. The AFIP/Miettinen system estimates the historical frequency of metastasis or tumor-related death after complete resection of untreated primary GIST. Risk estimates vary according to the primary tumor site, tumor size, and mitotic count. The clinical workflow section provides guidance on how to interpret these results in clinical practice. The AFIP/Miettinen Risk Table should always be considered together with pathology review, tumor rupture status, molecular findings, current treatment guidelines, and multidisciplinary clinical assessment. For more oncology calculators and clinical decision support tools, explore the OncoToolkit.